So for those of you who don't know, and probably many people, I'm on the doorstep of 32. I'm just a shade under, okay, about a month and change. Well, not even that, okay, a few weeks away, in fact. It's not like I'm trying to live forever or anything like that with this entirety of the channel, just looking at different health benefits of different things that you can add to your daily routine in order to live a more healthy, productive life. I just want to age gracefully, okay? I don't want to be like a vast majority of people out there where everything they wake up in the morning, everything hurts. Oh, my knees hurt, my back hurts, my hips hurt, my shoulders are wreck, and all that kind of just complaining nonsense. No, I just like to age gracefully, okay? Just like to live in my relative level of health that I have for the remainder of time. Most days I feel pretty good, but I, properly supplement in order to make sure that that happens. And something I added to my repertoire a few years ago was glucosamine, okay? And every once in a while, depending on the type of glucosamine I have, it comes with chondroitin, okay? It'll also come with MSM, I think, is that other little thing that's in it. We've talked about that before, but these two things join together and they really make your joints and your bones healthy, okay? Thank God, okay, touch wood. I have never broken a bone. I know this is pretty fantastical. I've played sports. I've roughhoused, boys will be boys, that type of stuff. And that's when I was growing up in the late 90s, early 2000s, about the last generations that was allowed to be rough and tumble. Never broke anything, thankfully. Okay, and I keep myself in good condition. I'm out running every day, and in the 6 months of the year in the place where I live, where it's uneven, slippery conditions, and I'll always fall once a year. I fell, when was that? Just before Christmas or something like that, and really got a good old bruise on my hip. But thankfully, like I said before, haven't broke anything, and I just chalk that up to good old conditioning, using my body every single day, and proper supplementation, taking care of yourself. And that's the entire purpose of this channel. Optimize yourself to live the best life you can for as long as possible. So, why my joints feel good? I'm at least going to chalk up a little bit of this to glucosamine and chondroitin, because I use them extensively. I go for miles, runs every single day, exercise like a madman every day. Supplementation and nutrition is a top priority for me, optimizing all of that. So let's focus in on one specific compound. Well, I guess a couple of them normally found together. Ergo, why I'd say that they're one specific compound. Glucosamine and chondroitin are structural components of cartilage, the tissue that cushions the joints. Both are produced naturally in the body. They are also available as dietary supplements. Researchers have studied the effects of these supplements individually or in combination on osteoarthritis, a common type of arthritis that destroys cartilage in the joint. Cartilage is the connective tissue that cushions the ends of the bones within the joints. In osteoarthritis, the surface layer of cartilage between the bones of a joint wears down. It allows the bones to rub together, which can cause pain and swelling and make it difficult for the joint to move. The hips, knees, spine, and hands are part of the body that are most affected by osteoarthritis. So, some common questions here. How much do we know about glucosamine and chondroitin supplements? Some of them are just garbage, but some of them are pretty good. We have some information about the safety and usefulness of glucosamine and chondroitin from large, high-quality studies in people. What do we know about the effectiveness of glucosamine and chondroitin supplements? Now, research suggests that chondroitin isn't helpful for pain from osteoarthritis or of the knee or hip. It is unclear whether glucosamine helps with osteoarthritis knee pain or whether either supplements lessen osteoarthritis pain in other joints. All you have is just anecdotal evidence, but it's weird how they would just single out these specific things. Ergo, why that you'd have some glucosamine supplements that would come in conjunction with chondroitin. Meanwhile, others won't. You can get like a glucosamine powder that you can add to a protein drink. I know that's a common thing for people to do, but we shall continue. What do we know about the safety of glucosamine and chondroitin supplements? They seem relatively safe, okay? Unless, of course, you're eating handfuls, which nobody ever should. Studies have found that glucosamine and chondroitin supplements may interact with anticoagulant, blood-thinning drug warfarin. Oh, okay. Overall, studies have not shown any other side effects. So if you're on blood thinners, maybe, I don't know, slow your roll on glucosamine and chondroitin? Only, maybe. I don't know. If you take glucosamine or chondroitin supplements, tell your healthcare providers. They do a better job caring for you than any dietary supplements you use. Point of order, but whatever. So, breaking it down, glucosamine. Major studies of glucosamine for osteoarthritis of the knee have had conflicting results. All right, so the NIH called the glucosamine chondroitin arthritis interventional trial, GATE, interesting, compared glucosamine hydrochloride, chondroitin, both supplements together, psilocybin, a prescription drug to manage osteoarthritis pain. So what is that actually doing? Because glucosamine and chondroitin are naturally occurring substances that are found within the body that work to, I don't know, fix and repair the cartilage as opposed to just a simple pain reliever. I don't really know if that's a fair comparison, but whatever. Or a placebo, obviously. That's how you work with these double-blind studies, if that's what this is. In patients with a knee osteoarthritis, most participants in the study had mild knee pain. All right. Those who received the prescription drug had a better short-term pain relief than those who received a placebo. Overall, those who received the supplements had no significant improvement in knee pain or function, although the investigators saw evidence of improvement in a small subgroup of patients with moderate to severe pain who took glucosamine and chondroitin together. Oh, okay. So imagine that a pain pill had short-term payoffs. More 11. In several European studies, participants reported that their knees felt and functioned better after taking glucosamine. Self-reporting study, that's what it seems like. The study participants took a large once-a-day dose and the preparation of glucosamine sulfate. That's another popular one as well that's out there, and that's another one that I alternate in there when I don't have the glucosamine MSM super pill. Nothing wrong with it. It's just, whatever's on sale at time. Purchase. Sold as a prescription drug in Europe. Wow, that sucks, because you can just buy it over the counter, just straight off the shelf, and at least in Canada. Researchers don't know why the results of these large, well-done studies differ. It may be because the differences in the types of glucosamine used, glucosamine hydrochloride in the NIH study and glucosamine sulfate in the European studies. Differences in the way they were administered, 1 large daily dose in the European studies and 3 larger doses in the NIH, are other reasons why, I guess. Well, also, and the type of study that you did, but one was self-reporting, I don't know, and you're comparing 3 different groups. In general, research on chondroitin has not shown to be helpful for pain for knee or hip osteoarthritis. But what about ankle, shoulders, elbows, any other joints that might experience osteoarthritis? But we're just looking specifically at knees and hips. All right, I guess they get the most use. More than 20 studies have looked at the effects of chondroitin on pain from hip or for knee or hip osteoarthritis. The quality of these studies varied, and so did the results. However, the largest and best study from the NIH under glucosamine showed that chondroitin doesn't lessen osteoarthritis pain. So, what are expert recommendations? We trust the experts around here. We follow the science. Experts disagree on whether glucosamine and chondroitin may help knee and hip osteoarthritis. But what about ankles? And the research, the American College of Rheumatology, ACR, has recommended that people with knee or hip osteoarthritis not use glucosamine or chondroitin. No, just get on pain pills. They seem to work in the short term. Ugh, whatever. But the recommendation was not a strong one. And the ACR acknowledged that it was controversial. Don't take it, but we can't really back up why you shouldn't take it. But here's an opioid. So other parts of the body. Yeah. Only a small amount of research has been done on glucosamine and chondroitin for osteoarthritis on joints other than the knee and hip, because there are only relatively small studies. No definite conclusions can be reached. But we can go ahead and surmise and philosophize as to why. No serious side effects have been reported in large, well-conducted studies of people taking glucosamine and chondroitin for up to 3 years. So, the NIH, who's normally very, very trustworthy and has definitely showed their reliance over the past 2 years, say that chondroitin's fairly useless, but glucosamine, I don't know, maybe. So, if you take it, the side effects are negligible, to say the least. Glucosamine and chondroitin may interact with, warfarin, obviously. A study in rats, which is, if you're going to be doing scientific studies on anything other than humans, rats are fairly reliable. Relatively, it's not exactly a one-to-one comparison, but it's acceptable. It's acceptable. It's a good place to start. showed that long-term use of moderately large doses of glucosamine might damage the kidneys. That's been circulating for a minute, but that's large doses. Although results from animal studies don't apply to people, this study does raise concern, again for the disclaimer that I offered at the beginning. Glucosamine may or might affect the way your body handles sugar, especially if you are diabetic or have other blood sugar problems such as insulin resistance or impaired glucose tolerance. So how so? Might affect? Okay. Again, a lot of unsubstantiated claims here. So if your joints hurt, see a healthcare provider. No kidding. If you take warfarin or have blood sugar problems, yeah, don't take it. If you're pregnant or nursing a child, seems a little bit weird because the physiological processes in your body kind of just account for the additional weight that you're going to be gaining during childbirth. So I don't know why you'd be taking anything specifically for your hip or your knee, and you're going to be seeing your doctor regularly. Help your healthcare provider to give you better coordinated and safe care by telling them about all the health approaches you use as normal. So, like I said, this is just merely anecdotal. Okay, this is just me self-reporting on this stuff. So take it with a grain of glucosamine. Really, I found it beneficial. It looks like there's some studies to back it up. As for chondroitin, maybe you're just paying for a little bit more expensive glucosamine. So if you can, to chop that off to save yourself some bucks, the sulfate version of glucosamine, totally acceptable, totally fine. But then again, the powder's just a little bit cheaper. So if you have something to mix that in, go for it on that one. Okay. So yeah, if you find your joints hurting, a little bit of that, consider some glucosamine, but I'm probably not the first person to recommend that for you. But if you're interested, now you know a little bit more. I thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.